Welcome to Eurofins ViraCore Clinical Diagnostics Podcast, where I'll be sharing up-to-date scientific advances, key diagnostic testing, and our most recent innovations. This is our aim is to connect with transplant professionals at this event while always staying patient-focused. Our aim is interviews aren't limited to any one profession. A diverse so whether you're a physician, lab director, transplant coordinator, patients, and even doctors or even the patient, also recipients, we would love to hear your voice. If you'd like to be a guest on our show, you can amplify your influence and tell your story. Summary on Amplify your influence on Transplant Radio. Enjoy episode 11 of our 15-part series.
Good afternoon and welcome to World Transplant Congress 2025, located in sunny San Francisco, California. Not California, just had some cauliflower, so sorry about that. This afternoon we're joined by Dr. Megan Kamath. She's assistant clinical professor, UCLA Health in Los Angeles. Megan, would you give the audience a little bit of an idea of who you are behind that title?
Yes, of course. Thanks for having me, by the way.
Great
and yes, San Francisco is sunny and surprisingly not so windy today. So I grew up in Ohio. I'm a Midwest gal at heart. I went to school in Ohio. I studied at the Northeastern Ohio University's College of Medicine, which is now called Northeast Ohio Medical University, or NeoMed. Graduated from there in 2011, and now to date myself a little bit, went to cardiology fellowship at Allegheny Health Network in Pittsburgh, Pennsylvania. Spent some formative years in my training there developing my love for advanced heart failure and transplant cardiology, and then came out to the University of California, Los Angeles, down in sunny Southern California, where I did my advanced heart failure and transplant training, and was fortunate enough to be recruited onto the faculty there and have been there ever since.
Wonderful, great background, provenance there. One of the things I did want to plug for you tomorrow during the conference at 07:30 a.m. Too early in the day for this, but session you're sitting in with a bunch of other esteemed colleagues is transitioning pediatrics to adult transplant programs. The topic of your 15 and 20-minute discussion, challenges and opportunities for improvement. You want to give anybody a little foreshadowing on what you're going to be talking about tomorrow?
Absolutely, yes. And this is for the early risers, but hopefully it will be recorded or captured in some way for all of those folks who won't be attending at 7 a.m., which may be a majority of people since they're probably going to enjoy San Francisco tonight. But as you know, transitions in heart transplant are a really crucial time period for these vulnerable, complex patients who have been transplanted during their pediatric age span. And it's really important to highlight what we're doing well, what we can do better. As we all know, medicine has so many opportunities for improvement as well. And so what I'm going to be covering in great detail is some of the barriers that I've seen in my practice and my group, some of the ways that we have worked together to overcome some of those obstacles and challenges. And I'm going to really challenge the group to innovate, because that's really why we're here at these meetings like the World Transplant Congress, to come together, to build community, to find new ways of improving patient lives, creating better patient outcomes. We want to see those patients who've had a transplant live as long as they possibly can and as well as they possibly can too.
Exactly. So you talked about innovation and like that, I guess, expressing a bit of my ignorance here, transitioning pediatrics to adults, I assume that there's some differences in the pharmacokinetics of the therapies and like that. So expand upon that?
Yeah, so there's certainly differences between a pediatric patient and an adult patient, but in terms of innovation, some of the things that I'm talking about are ways to engage patients better, right? Some of these pediatric patients may not truly have understood the reason why they needed a transplant, because they got transplanted at such a young age that their parents or their other caregivers may have been helping to guide some of that decision making. So some of the ways that we're innovating, particularly at UCLA, is incorporating patient engagement into this process and patient education into this process. process. So for example, we're working with our pathologists, the specialists that help us look at the organs once they're taken out of the body, to teach these patients about what is going on with their condition, to show their patients, oh, here was your old heart. This is why it wasn't working, and this is why it's so important to take care of your new transplanted heart. So we're developing these types of new programs. We're creating these new types of ways to engage patients and their parents. We want to make sure that these patients whose parents have been involved in their processes from a really young age still find ways to be connected, right?
Right.
And so I think those are the kind of things that we're going to be highlighting. Of course, there's a lot of innovation in the diagnostics space as well, and we're learning from our experiences with both pediatric and adult heart transplant recipients in that area too. I think there's more research that has to come out there to talk about how that might play into a transition of care protocol or plan. A lot of programs that are state-of-the-art and cutting-edge like ours, we're developing these programs to help standardize how a patient goes from pediatric care to adult care so that we don't lose ground during that critical time period.
Yeah, and I mean, just kind of use an analogy or a thought on this. It's kind of like thinking, okay, my kid's going to university, and hey, you got to wake up in the morning, you got to go to class, you got to do this, you got to find yourself food, you got to do your own laundry and like that. But then to add on the aspect of, hey, you also need to worry about self-care, take your medications, talk to your healthcare providers and such. So what type of training or programs do you have for that?
Yeah, so we work together a lot with our multidisciplinary team members in that regard. And what we do when the patients transition from pediatric to adult heart transplant clinic is that we invite them to come and visit us and visit our whole multidisciplinary team. And we actually have the pediatric team and the adult heart transplant team meet together and discuss these patients beforehand so that we have a handoff on the medical end of things. And then we meet the patients, their parents, and any important people in their lives. And we get to walk them through our clinic in real time and say, okay, here's where you're going to be coming in. Here's our front desk staff. Here's the lab draw. Here's the echocardiogram.
Right.
And we try to make it a comfortable experience for them that way. We also try to empower them with the power of technology, right? We have a MyChart app, through Epic, where we reach out to them and we say, hey, we haven't heard from you in a while. Let's check in. And sometimes as they're transitioning from that pediatric to adult group, we may need to help them with that a little bit more. But we found that as they become more comfortable with us, they themselves are more empowered, and then they're reaching out to us saying, hey, I just want to give you an update that I finished my master's degree, I finished my bachelor's degree.
Wonderful.
And it's great to see them thriving and doing so well despite all of the adversities and challenges that they've had to overcome.
Exactly. That's phenomenal. Phenomenal. So I also see, looking at your biography or bibliography, I don't know what it is called, but hey, it's late in the afternoon. You do a lot with clinical research and mentoring. You want to expand upon that?
Absolutely. So yeah, in the clinical research sphere, I'm involved pretty heavily with heart transplant outcomes research in terms of disparities in care, in terms of trying to, again, like I mentioned, ensure that our transplant patients have the most optimal outcomes that they can with the best quality of life and quantity of life. So we have been doing a lot of work in those areas. We have also been doing work with imaging in heart transplant patients to help understand how we can predict changes that may occur in the post-transplant course, and if we can predict them earlier using different imaging modalities. So we're really trying to take a multidisciplinary approach to looking at these transplant patients, and I would say actually a holistic approach too, recognizing that they're more than their transplant. We have a whole person that we're dealing with here. To talk a little bit about the mentoring aspect of things, I have a deep commitment to medical education. One of the reasons why I went into medicine was because I wanted to be able to teach my patients, teach their family members, teach future medical students, residents, fellows. And that's really one of the joys of my day-to-day life as an advanced heart failure and transplant attending, is getting to spend time on the wards with the residents and the fellows and the CCU, and really getting to talk through hemodynamics or talk through transplant rejection, or you name it. It's just kind of nice to know that you're having a ripple effect on the future generations that will pass it on, hopefully, too.
Yeah, that's good. Now, you had mentioned a little blurb that I wrote down here, gender disparity of care. Is that because heart disease and the need for a heart transplant, people always go, oh, that's a male segment of, care, and women really don't have heart attacks. Women really don't need heart transplants. They don't need that type of care. Is that what you're talking about by that statement?
Often that is the case. Often people don't know that women can present differently, right? Women may not have those typical chest pain symptoms that a man does, right? Instead, a woman might have shoulder pain or indigestion or shortness of breath, or in the case of one of my good friends, a cough that presented as a manifestation of her coronary artery disease. And so I think it's just really important to bring awareness that people have different symptoms. People have different presentations of symptoms, and it's important to take those things seriously. I often joke and say that women put themselves on the back burner quite a bit because of the fact that they're taking care of everyone else. We're juggling 100 million things, and we don't think about ourselves. But I think not just women, but men too, everyone should really take a proactive role in their health, because I think knowledge is power, and knowing, oh, this is not right, if your gut is saying that, listen to that.
Yeah, and that's interesting, because I did read the article about the lady who was like, oh, I had a persistent cough, it was getting bad, I went to see a pulmonologist, oh, here, try this inhaler. Excuse me, sorry, my allergies are bad here. Try this inhaler. Oh, let's add this inhaler. Let's add this. Let's add this. And it subside, you come back, and it's like, oh, maybe you need to go see a GI doc. Oh, maybe you got GERD or something like that coming, that's causing you this cough. And you were talking to her, and she's like, oh, I've been having this cough. And you're like, hey, let's get a heart CT and figure out what's going on. It's like, boom.
Yeah, it was a really unique experience there, and I would say it just highlighted for me the importance of thinking and looking at someone holistically, right? When I observed that particular patient, right, I saw that her cough was occurring when she was ambulating or walking around, right? And I noticed that it wasn't as prominent when she was sitting down. And so I thought, could this be something that's heart related, right? And so I think just giving yourself, as a clinician, the possibility to think about that, right? You have to think about it to be able to consider it.
Right.
And I think that's really important too, because so often we can get, very narrow-minded in our view of things, that I think it's important to take a step back and look at the holistic approach too.
Right, yeah, and it's wonderful. And this patient had a stent put in.
Yeah.
Been doing well for a number of years now.
Yes.
And a good thing that it's like, maybe it's this. Let's look at something. People say sometimes you have to look for that zebra in that herd of horses to see exactly what it was. And kudos to you for doing that, and even more to her for taking your advice and getting that checked out.
And I can't emphasize that piece enough, right? We can do the talking, we can do the recommending as clinicians, but it's a partnership, right? It's definitely a community, and to be able to provide that type of care, is something that I see as a true privilege and an honor.
Yeah. And that's one thing that's really stuck out to me with this year's conference. There's a lot more talk about engaging, involving, and getting your patients to take those next steps, to follow the direction, to go forward, and more of how can we do better as clinicians at engaging them and educating the patients on this is what it may be, and this is what the next steps down the road would be. Here are support groups to help you out. Either post-transplant, or pre-transplant, post-transplant, such. We've talked with a lot of the national organizations, and they're saying, you can't forget you've got that community of caring and support that, okay, we've taken care of the patient, but those support people need care, and they need some follow-up, and they need time to process what's happened and to kind of maybe take the foot off the gas a little bit and go, okay, now I can start to relax and start thinking about other things too, and just remembering everybody. It's not an N of one, it's a community that's involved in anybody that is either pre-transplant, post-transplant, and then follow-up.
Absolutely, and I think the point is that it takes a village, right, to get a patient through transplant process, right? And it doesn't start or end at any particular point. It's a continuum, right? And I think the other point that really resonated with me that you just mentioned was, the fact that there is so much collaboration here that we're seeing at this Congress to really empower patients to get information from trusted, accurate sources, right? There's so many sources of information out there these days, which is a good thing, but it's also a challenge.
Right. Well, so people need to also realize, look at the publication date on some of that stuff. Oh, this is from, the early 2000s. That's been 20 years ago.
Exactly.
Light years of changes have happened in the past 20 years. We've learned so much, and it's through congresses like this where that information sharing is really important.
Exactly, and there's years and years of work that clinicians and researchers like myself put into these conferences, right? To be able to present a paper, or to be able to give a talk, or to share our preliminary data with other like-minded individuals, right? Or other preeminent researchers all over the world. And so I think that opportunity to share that information in this way is really unique too.
Yeah, and I just wanted to back up and revisit something. We talked about the care for the caregivers and the patient, but it's also the healthcare workers need to have care given to them in a way, to process it, because it's not an easy task. You become fully involved and with that patient, with their family and such, and you want to see the good thing that happens at the end, but caregivers need to de-stress and take some time out too and just breathe.
Yes, and they have this saying that you hear every time that you get on a plane, right? Which is put on your mask before you help someone else.
Right.
And I think that really applies in this case, right? You got to take care of yourself before you can take care of others. That is actually another area of interest for me, is physician, clinician, healthcare worker, team member wellness. I think in this day and age, we have such stressful, busy jobs and lives, and so demanding, right? Because we know how high stakes what we're doing is. And because of that, we put a lot of pressure on ourselves. And so that's one of the other areas that I've really chosen to focus on. I've been our division wellness champion at UCLA for the past academic year, and that has really been a wonderful experience to try to bring ground level change, grassroots change, small things, right? To be able to improve the lives of our clinicians and our staff members so that they can be able to take care of others more effectively.
Very good. So I told you I've got a gotcha question, air quotes.
Okay, I'm ready.
So, for you to de-stress, relax, and like that, I understand that you're working on your baking and cooking skills.
I sure am.
How are those progressing?
So, I have to say that I really enjoy the scientific aspects of baking, because you can really tell a difference in the texture of a baked good depending on what type of butter you use, depending on the fat content of that, depending on the flour that you use. So I am the proud new owner of a Zoji Rushi bread machine, which has been really good. I've been learning how to do a lot of recipes there, and it takes a little bit of the work work out of it, but it's kind of fun. And so it's been a nice way for me to just kind of learn a new thing. And I think that theme of lifelong learning, right, whether it's in medicine, whether it's in cooking or baking or other things, has been something that's really resonated throughout my whole life. And I'm hoping to continue things like that in the future.
That's awesome. And it's like my wife can always tell when I come home stressed because I go to the kitchen and I start making stuff. And she's like, what are you doing? I said, you're not having to cook. Don't worry about it. She goes, I'm not, but you don't make a mess.
She's worried about the cleaning.
She's worried about the cleaning, exactly. But like you said, I have a minor in chemistry, and cooking is basically chemistry.
Yeah.
Balance your acids with your basics, your sweets with your sours, and like that. And just, a little subtle change can mean the difference between a raving success or an utter failure.
Absolutely, absolutely. So what's your signature dish?
Depends on my mood. No, I make a pretty good green pepper steak.
Oh, okay. Well, that should be on our list for next time.
We'll exchange recipes.
That sounds great.
Anything else you want to share with our listening audience while I got you here captive?
Yeah, I would just like to say thank you, to everyone that's been a part of this, everybody that's been a part of my personal and professional growth. I think it's always important to take a moment to show gratitude for what you've done, where you've come from, and the people and the communities that have helped you along the way. So I appreciate everyone that has helped me get to my where I am at this point, and I'm hoping to continue this beautiful journey, taking this forward as I progress in my transplant career and taking care of patients, research, the whole trifecta.
Yes. Well, great.
And if people want to come for that 7 a.m. session tomorrow, they're more than welcome to. We're in room 23.
Are you going to be making pastries?
I'll find a way of having maybe one of these vendors come in and do some maybe coffee.
There we go. Well, thank you very much for taking the time out of your busy day. I appreciate talking with you, and don't be a stranger, and good luck on the talk tomorrow.
Thank you. You too. I enjoyed talking with you very much. Have a great day.
You too. Bye-bye.
Make sure to subscribe to this podcast and follow us on social media to stay up to date on all the latest information. If you want to help spread the word, please give us a 5-star review and tell your friends and colleagues to subscribe too. We're available on Apple Podcasts, Spotify, Google, Podbean, and more. With over 40 years of diagnostic innovation and specialized expertise in infectious disease, pre- and post-transplant, allergy and immunology testing for immunocompromised and critical patients, Eurofins ViraCore is committed to helping medical professionals, transplant teams, and reference labs get results faster when it matters most. ViraCore is passionate about delivering value to our clients by providing timely, actionable information, never losing sight of the connection between the testing we perform and the patients you serve.